Okay. All right. I want to welcome everybody today. My name is Evan Adler, and I'm a physical therapist here at UNC Therapy Services. And welcome to Therapy Thursday. Today is Thursday, February 10th. And what we're doing here today is we're bringing to you another episode of our Therapy Thursday series, which is an informational series brought to you by UNC Therapy Services and our community engagement committee. Our way of continuing to reach out to the community and be involved with everyone. Unfortunately, done more in a virtual way since we are not doing as many in-person events due to COVID. But very excited to have you all here today. People are still kind of dripping in. That's great. Today we have a very pertinent topic, very timely topic. From what I can tell, I've seen a large uptick in cases in my caseload as a physical therapist for TMJ disorders, or of the temporomandibular joint, better known as your jaw. So that's what we're going to be talking about today. Before we go too much further, I want to let you all know that we have the chat function is available. So if you have questions during the talk, I encourage you to use the chat. If I can answer something during the presentation, I'll try to do it. If not, we'll try to save it to the end. I also put the links in there for our Therapy Thursday YouTube channel, so you can go and check out past episodes of Therapy Thursday with a whole variety of different topics there. And then our Facebook page, where you'll be able to find information about different events, both virtual and in person, brought to you by UNC Therapy Services and UNC Health. Okay, enough with the formalities. So what I'm going to do is I'm going to go ahead and share my PowerPoint, and we can get on our way. All right. So today's talk is called How Not to Pop and Lock, TMJ Pain and Disorders. There we go. Tell you a little bit about myself. Again, my name is Evan Adler. I'm a physical therapist. I'm the clinic coordinator here at the UNC Wellness Center, located in Northwest Cary, here in North Carolina. I know some of you are viewing from other states, so thanks for joining us. I'm a board certified orthopedic specialist. I also have specialty certifications in using Graston technique, which is a form of instrument assisted soft tissue mobilization, and dry needling, or intramuscular trigger point release. I am originally from New York, but I've been down here in North Carolina since 2008. So been here a long time already. I'm very active myself. I like to run, play tennis, play softball, ride my bike. Big music enthusiast and proud husband and father. You can see my boys there, 6 and 2. They keep me real busy. So real busy and real stressed, which also kind of flares up some of the stuff in my jaw as well. So I have some issues, and we're going to get into that a little bit too. All right, so today what we're going to try to do, our objectives are to kind of summarize some of the current status of temporomandibular joint dysfunction and interdisciplinary care. So as a physical therapist, I'm part of that interdisciplinary care, but we'll talk about where we fit in that role. We're going to describe some of the elements of a comprehensive physical therapy examination and some of the interventions, and we'll kind of demonstrate some of the key manual interventions, which is usually my primary way to treat most TMJ issues, and that comes from a lot of the research and from personal experience. All right, so let's talk about the prevalence of TMJ issues, or TMD. So the TMJ, or the jaw, is the most used joint during daily function. Okay, we're talking, we're eating, we're chewing, we're yawning, all day long we're using it. 75% of the population suffers one symptom of TMD at some time in their life, whether it be a pain or a clicking or a locking or just some sort of discomfort there. There are many things that can contribute to it. A lot of us get it. 35% or more of general population samples have signs and symptoms. However, only 5 to 10% actually seek treatment. A lot of people just kind of let it go and figure it'll get better on its own. But most just don't know what to do when it happens, where to go, who to see, and that PT is even an option. Uh, and what it does, it affects population of all ages and genders, but most who seek care are more likely to be women between the ages of 20 and 40 years old. Just something that we found through the research, but there's a higher prevalence within that age and gender group specifically. Unsure of exactly why, but that is what we see. I'm sure women between 20 and 40 that are on this talk today could probably attest to why more specifically than I could. All right, so there's my guy on the side. He's doing his popping and locking. It's not really what we're talking about today, but like I said, I have 2 kids. I'm gonna do dad jokes anytime I can get a chance. So what we're talking about is these popping, clicking on opening and closing. So as you open your mouth, you kind of get this click or this kind of loud popping sound. You can get it on opening or when you're closing your mouth. Usually it'll happen on one side more than the other. For me personally, my left side is the one that gives me issues. Other TMD symptoms that you'll get, pain at rest. So you just kind of get this kind of throbbing type sensation, or you can even get kind of a sharp pain in there. You can get pain with chewing. So, we end up having to alter our diets just so we can deal with this type of pain. Softer foods, shakes and smoothies versus, peanuts and pretzels, just to avoid some of these pains. You can get locking the jaw open or closed, which is a fairly scary event to have. If you have no outside force acting upon you and you're unable to open your jaw or it's stuck open and can't close it, that's a real concern. And we do have patients that come in with that, and fortunately, we're able to help a lot of the time. TTP stands for tender to palpation. So just kind of touching at the side, right along your cheek or all the way up into the joint, which is kind of right in front of your ear. Any tenderness in there can be quite uncomfortable. So one thing that I've noticed is that the influence of COVID-19 on the TMJ and TMJ disorders. There have been several studies recently showing that since the pandemic has begun, there have been an increase in the following oral conditions, right? So cavities, tooth fractures, jaw pain, teeth grinding, right? This is secondary to external factors, right? So a lot of us are not taking care of ourselves maybe as much as we should. We're not going to the dentist for regular checkups as much as we were before. We are grinding our teeth from increased stress. We're eating differently, we're sitting differently. These are all these secondary effects of the pandemic and can manifest in jaw pain. We had a talk on Therapy Thursday not too long ago called Pandemic Neck, talking about how we've all kind of gotten into this position where we're more slouched and head forward, so we all kind of look in this position through a good part of our day, and that influences your jaw function as well. So a recent study found that TMJ and bruxism can be a possible outbreak factors in patients suffering from COVID. Bruxism is another word for clenching and grinding your teeth. So it was cited that there is a significant increase in facial pain, including jaw pain, that's linked to jaw clenching as well as teeth grinding. Again, this could be very well the result of high levels of anxiety and stress that many people are experiencing since the beginning of the pandemic. I've noticed an uptick in TMD from increased mask wearing. People are unconsciously or subconsciously, unconsciously, kind of tightening up some of these muscles back here because of the pulling on the ears, which end up tightening up some of these facial muscles, which can have an effect on the jaw as well. I know there are a bunch of healthcare providers on here who have to wear masks for 10 plus hours a day, and it absolutely takes its toll. So just know that there are avenues for help for this. All right, let's give a little bit of history of TMD, or temporomandibular joint disorders. So since the 70s, TMD has moved toward that interdisciplinary model of care, including physical therapy. PTs can contribute significantly to the care. We have many ways that we can help, and we're going to go into some of that later on in the talk of how PT can help. But the picture of that friendly gentleman over there, that's Dr. Roccabato, who is a physical therapist who's done extensive studies on the effect of his 6x6 home exercise program to treat TMD. And he was kind of at the forefront of interjecting PT into this interdisciplinary model of care. So we have him to thank a little bit for PT's involvement. So typically what will happen is that if you have jaw pain, one will seek care from their doctor or their dentist first. That is just the typical point of entry. Now, I should mention that in 40, I think it's 48 states, if you have commercial insurance, so if you don't have kind of Medicare, Medicaid, TRICARE for military, if you have, just regular old commercial insurance, you do not need a referral to go to physical therapy for an evaluation. Okay, it's certainly the case in North Carolina, as is the case in most states. So check with your insurance, but you do not need to see your doctor first to come to physical therapy. Now, that's not just for TMJ, that's for across the board, back pain, shoulder pain, you name it. Okay. But when we talk about the interdisciplinary care, you have your doctor, your dentist kind of at the top of the chain there. And then you have all of these different disciplines kind of helping to work together. So you have your mental health professionals. So important, especially now, that we're all super, super anxious and stressed with the pandemic and trying to get back to some sort of normalcy. A mental health professional is very, very helpful. Along with that, you have occupational therapy, speech therapy, and then, of course, your PTs. And then adjunct to all that, you have alternative medicine. So yoga, meditation, mindfulness, you can kind of read them all there. But once you put this into one big package, it is certainly possible to help with jaw pain in a non-surgical manner. All right, so where does PT kind of fit into all this? On the physical therapy examination, we kind of start and we kind of want to knock out any of these red flag items, these things that say, okay, you know what? You may have jaw pain, but this is not just the jaw talking. This is coming from another place. You need to go to neurology. You need to go somewhere else. So that's what we all do first time around, is kind of take a look what's going through there. Are you having any systemic factors, any neurological signs? Did this come out of nowhere? Are you having a pattern change? Are you increasing? Is it associated with the Valsalva maneuver? So are you bearing down, kind of like holding your breath and kind of grunting a little bit, right? Kind of increasing that intra-abdominal pressure that can cause an increase in blood pressure and result in some of that jaw pain. Do you have headaches that go along with it, that come before or after it? And just kind of sussing out all of these little factors that we can tease out before we start to treat what we see there at the jaw. All right. So what I find is the most important with any assessment for physical therapy is the subjective assessment. Okay. So what happened? Patient comes in and say, my jaw hurts. I'm like, fantastic. Tell me your story. Where did this come from? What happened? Tell me a story about what's going on. So it's important to find out, medical history in the family. Is there a history within the family? How did this all start? Was there any sort of trauma that was involved? Did you bump, did you get hit on the jaw, messing around with a sibling? Did you fall? Did you get hit with something? Um, and then kind of the sins. How irritable is this? Does it just come on quickly and go away quickly? Or is it just there all the time? Looking at things kind of dental history. Are you accustomed to, have you been wearing braces? Do you wear a night guard? Do you grind your teeth? Have you had recent dental work? All these things can lead us down the right path to figure out what is the pain generator for this jaw pain. And then parafunctional activities, grinding or clenching teeth, that bruxism, that's usually the first one that we always kind of hear about and see. But then you get, other parafunctional activities. Unfortunately, I am a nail biter. I have been for a very long time. And I know that I always kind of chew to this side, to this left side of my mouth, and that causes a lot of extra compression on this side, and contributes to my symptoms right there. Do you eat a lot of crunchy foods? Do you chew gum? Do you have a resting posture for your face where you are kind of clenching your teeth? And all these different sort of things can come out on the subjective assessment. All right, once we finish our subjective, we move on to our objective assessment, right? So now you told me what happened. Now I'm going to look and kind of figure things out for myself. The first thing I want to do is clear the upper quadrant and the neck, right? So I want to make sure there's nothing coming from any neurological symptoms. Is there tightness within the cervical spine or all the way up in the muscles, in the suboccipitals behind the skull here? I want to make sure there's nothing nefarious kind of contributing first. And then what's extremely important is that posture, that seated and standing posture. You can see that picture there, where she is sitting with that kind of forward head, kind of hunched back like this. And it causes a mismatch in the length tension relationship of the muscles around her neck, right? So the muscles toward the back here get really, really kind of shortened and tightened up, while the muscles in the front here get really kind of over lengthened, and they don't act in the way that they should act. And this can result in neck pain, back pain, shoulder pain, and of course, headaches and jaw pain from there. So I'm also going to look at range of motion. Okay, I want to see how much, not just your neck is moving, right? Can you rotate? Can you extend? Can you flex your head? But also your mouth, right? How far is your jaw coming down? Is it deviating as it's opening? Kind of going off to one side or the other? Can you move your jaw from side to side without pain? All of these things are going to tell me what's involved. Then we go to more of the palpation, right? So how does it feel, right? So I'm going to palpate the muscles and the joint capsule. So kind of going through the muscles, right? So you have kind of your masseter, which is here. So masseter, mastication. This is the one that helps you chew here, right? You also have your temporalis up here, also helping to chew. You've got suprahyoids and infrahyoids. So those are like super deep muscles down in here. And, those are muscles we can kind of get to from the front, but we also have to go into the mouth, so intraorally. Gonna palpate some muscles there, your pterygoids, which are these kind of oblique muscles that run on the inside of your mouth, help to open and close your jaw. And then we're gonna kind of go at the joint, right, if you feel like right in front of the hole of your ear, and kind of place a kind of a broader hand and just do a little bit of open and close, you can feel exactly where that jaw starts to open up. All right, so right in here, if it's tender, right on that spot, touching on the capsule, touching on the bone, and then the muscles around there. We're also going to look at the capsular mobility, right? So I'm going to actually go in and take a hold of the jaw, gently, of course, and kind of move the jaw back and forth, side to side, and see what that end feel is, and see if that capsule is moving appropriately. So the next thing I want to talk about is recognizing kind of how the jaw opens, opening and closing, okay? Because this will tell me a lot. So there are variations in the opening and closing patterns. So one that we see is a C curve. Okay, so what we see here is that as the jaw opens, if I follow the bottom teeth, they'll kind of open, they'll deviate to one side and then come back to the center when you get down to the bottom. Okay, so this usually occurs secondarily to a hypomobility, so a tightness, decreased motion due to an internal derangement. So that could be the capsule in particular, kind of the tightness of the ligaments around here. And the jaw will deviate towards that side that is affected during the mid-range before it returns back to the center. Excuse me. So like I said before, my left side is problematic. So for me, when I open, it kind of deviates this way and then comes back to the center. So I'm a case in point right there. An S curve is usually secondary to the hypermobility of the joint, right? So hyper meaning there's too much mobility. So there's poor neuromuscular control of the muscles, right? So that means that the jaw is just not being controlled. It's just kind of off and doing its own thing, and the muscles need training, just like any other muscle needs strengthening to make the joint work appropriately. Okay, so structures causing dysfunction can include the muscles around there. We talked about the masseter, the temporalis, and then we're going to talk about the disc that lives within the joint in just a moment here. And this is what most people will have issues with, especially if there's clicking or locking. Okay. So when we're talking about a disc issue, what we have is an anterior, so that means to the front, disc displacement with or without reduction of the disc. Okay, so if you look on the left, this is what happens when the disc is, that it does reduce within the motion. Okay, so the first motion as the of the temporomandibular joint is a rotation within the joint. Okay, so the jaw kind of starts to open and you can feel a little rotation within here, right? Through the first half of the motion. The second half of the motion is a translation to the front or anteriorly. Okay, in a perfect world, you have a disc that sits right on top of that, in that joint, and it's equally distributed from the front to the back of that bone. All right. In an anterior disc displacement, that disc sits to the front of that bone. So if you look at that left where there says ADD with reduction, that A says teeth together with disc displaced anteriorly. As it starts to open to B, the disc starts to slide back. So by the time you get to C, it clicks as it rotates and the disc goes into place. Now you continue to go through and you get to E and F, and as you close your jaw, it clicks again as that disc slides forward again. Okay, so that's the click on opening and the click on close. Okay, I'm gonna stop sharing this for just a moment. Oh, awesome, we got more people than I thought. Excellent. Hi, everyone. I want to show you a quick video. Let's see here. I want to share. Okay. So this is done with a cadaver, and you can kind of see here in slow motion how that disc kind of jumps. All right, so now it's closed. Now it's opening, the disc jumps back, translates forward. As you come back, the disc jumps back to the front. Okay, so click and click, click and click. Do just one, we'll let them come back into place here. All right. Sorry for those that weren't expecting to see something like that, but I really think it helps to show kind of what's going on internally in the joint. So if we go back to the other version, you have your the disc is in the front, and then on that opening phase, it stays there. And now there's no clicking involved because that disc doesn't move, but your motion is severely limited because you can no longer translate the jaw. You can only rotate in it. So you only get half that movement. And that's kind of that feeling of being locked into place. Okay, so test that we're going to do here, we're going to load the TMJ. So we're going to put pressure in through here, okay? Biting down on an object with the back molars will actually result in a gapping of the same side of the TMJ. So if you've got a cotton roll between your molars on your left and you clench down, you're going to get an opening on the left and a closing on the right. All right, seems a little little counterintuitive, but that's kind of what's going on there. So then you also have upper lip and bottom lip biting, right? So if you bite your upper lip, you have to protrude your jaw to do that, like this. Or if you're going to bite your bottom lip, you need to retract your jaw and pull it back to come this way, right? Do either of those cause any pain? As I'm going through, if I can palpate, if I can actually touch and hit a trigger point, a muscle spasm in one of these places, well, I know that that's probably what's helping to cause some of that pain. Okay, so where do we come in as PTs to help fix this? Well, if one of the major things that physical therapists do, in all cases, is we're educators. Okay, I wouldn't be doing these series of talks if I didn't love to teach people. So, teaching people some relaxation techniques, postural correction, make sure we're sitting upright and getting out of that forward head posture. Oral habit modification, right? So while things are really flared up in here, we don't want to be chewing gum and lots of crunchy foods. We want to try to adjust our diet temporarily while we can get things back to baseline. We can apply modalities. Now, we don't do this all that often, but it can help in certain situations. So applying heat, ice, TENS units, which are electrical stimulation at a low level to create some pain relief. Phonophoresis or iontophoresis, which is the use of a steroid kind of being driven in through the skin, using kind of these pads. Nothing painful, just options that we have. But most importantly, we're going to treat the impairments. So if you're lacking range of motion, we're going to be working on range of motion. If there is tightness and pain, we're going to be working on trying to loosen those things up. And here are some more specific things that we can do. So if you see there, you get a little more idea of what muscles are all around there helping to move your jaw. So here are these manual techniques that we can use. So soft tissue mobilization, right? So different types of massage techniques outside of the mouth and inside the mouth, targeting the masseter, the temporalis, your pterygoids on the inside, what's called your sternocleidomastoid muscle here, which is usually a large offender for these pains. We can do instrument-assisted soft tissue mobilization. So those are using these stainless steel metal tools to help find these trigger points to help and release them along the way. I've done another talk about dry needling in the past. I've had incredible success with dry needling for TMD patients. Needling of the masseter, the temporalis, even those pterygoids that are really kind of deep in the mouth can be reached from the outside to needle those and create a really nice release of those muscle spasms. Joint mobilizations for the jaw itself, for the cervical spine, for even the thoracic spine, just to get these global releases to help loosen things up. Then we also focus on neuromuscular re-education and exercise to help the jaw move appropriately, particularly for those kind of like S-curve cases, to try to get things to open and close the way that they should. All right, let's go back to our friend Roccabato. So he coined this 6x6. So I know everybody here has their video off, and that's totally fine. But I want you to try a couple of these as we go through here. Okay, so the first one are tongue clucks. So one thing I didn't mention before is that the resting position of your tongue at any given time when you're not using it, right? So if you're not eating, drinking, talking, whatever, your tongue should find a resting place at the roof of your mouth behind your teeth. Okay? So a lot of people, I'll ask people when they're here, say, okay, where's your tongue sitting right now? And they're like, okay, it's on the bottom behind my teeth. Like, okay, that actually takes active muscle to bring it there. The most open pack position for your jaw is going to be with your tongue resting against the roof of your mouth. Okay? So while you're doing that, you can do some tongue clucks. So you find it there, and you're just kind of doing this kind of like clucking. So and helps to kind of create that little suction at the roof of your mouth and kind of remind you where that tongue is supposed to be. Then we have a controlled rotation on opening. So if you keep your tongue to the roof of your mouth and keeping your tongue there, open your mouth, you'll only be able to open your mouth about half the distance you normally would. And that half distance is going to be that rotation within the joint, and you're going to avoid that translation to the front. So you're training within the joint. So the tongue is at the roof of the mouth, and then you're opening. Okay. You also have some mandibular rhythmic stabilization. So basically, keeping your jaw in a steady place and providing some pressure in different directions without letting your jaw move from that position. Number 4 is stabilizing head flexion. So trying to isolate this little nodding movement so that you're really trying to nod from very high up in your neck as opposed to flexing all the way down like this. And then coming off of that one, you also have lower cervical retraction, which are chin tucks. So bringing your head straight back as if it were on tracks. So from here to here, here to here. And that helps to kind of reset your neutral neck posture. The last one is for your shoulder girdle. So doing some shoulder retraction. So just kind of pinching your shoulder blades back, pinching your shoulder blades as if you're trying to pinch a pencil in between them. Again, helping to realign that entire posture can help to affect your jaw. Okay, so with all that said, I'm sure there was a lot of stuff in there that you have questions about. I'll open up the chat here and take a peek and see. I think someone asked a question. So I'm going to go ahead and put that up. It has my contact information there. So as I'm going through here, if anybody has any questions for me directly and you don't feel comfortable asking here, please, please, please feel free to reach out. You have my email there. Use me as a resource. It's what I'm here for. I'm happy to help. Let me take a look here. Chat. Okay, so I got a question that said, just for confirmation, the video that you just showed was illustrating how the jaw should move, or was that also disordered? Okay, that's an excellent, excellent question. So the video, I'm going to go ahead and pull it back up so I can talk about it. So the video was showing it was a proper movement. The disc was not operating properly, but the translation was pretty correct. So here it is. So you get a little bit of roll, and then there's the translation coming forward and back. There's not as much roll in this video because what they're actually doing is they're grabbing a hold of the jaw and pulling it down. And you also kind of have to note that this is also a cadaver model, and that has been bisected. So basically they cut through the body right about here. So it's not fully accurate, but you can kind of see what's going on, especially with the disc. This is what it looks like when the disc is not reduced. There's the disc right in there. If you can see my mouse, it's here. And it just stays to the front. And it doesn't translate as far as it can go because there's a big blockage in the way. There's also a lot of restriction coming from behind because the disc is still attached to the posterior part of the joint, and that's getting tight and not allowing it to go through there. All right, again, my apologies for those of you eating lunch. That was disturbing for. I apologize for that. Okay, you're welcome. Thank you. So were there any other questions that I could help answer for people for today? I know that I have people, I think I have people coming in later today that to treat for TMJ, and I know I have some dry needling on tap for them today, and a lot of manual work, then going into some of that neuromuscular re-education, all trying to help retrain that joint, kind of reset and get people moving again. I'm going to go ahead and put in the chat one more time here. These are links to our YouTube page and to our Facebook page. I do encourage you to go ahead and check out both of those. Our YouTube page, go ahead and subscribe, and you'll find out when new videos are posted. And you'll see our whole library of talks that we've done here the one on dry needling and pandemic neck, and a whole variety of different topics there. And yeah, I think that's what I got. Does anybody have any other questions for today? Going once. Going twice. All right. Well, in that case, I'm going to wrap it up here. I do encourage you to go check out those websites. Thank you all so much for joining me for this talk today for Therapy Thursday. We're going to be continue to do these once a month, and you'll find out more information about the topics ahead of time by going to our Facebook page. And that's about it for today. So thank you all so much, and we'll see you next time.